Coba perhatikan baik-baik. Inilah hasil USG dari pasien yang sudah menjalani stimulasi hormon. Terlihat jelas banyak folikel yang matang dan siap ambil. Benda putih ini adalah jarum OPU. Jarum inilah yang akan menyedot cairan folikel satu persatu. Dan hasilnya akan langsung dialirkan ke tabung khusus dengan suhu yang dijaga ketat 37 derajat Celcius agar sel telur tetap stabil dan gak rusak. Tapi prosesnya belum selesai sampai di situ, sister. Setelah folikel tersedot, embriolog masih harus bekerja mencari sel telur di bawah mikroskop. Iya, literally dicari satu persatu. Mungkin kamu sempat bingung ya, kadang disebut folikel, kadang sel telur. Sebenarnya beda nggak sih? Di video ini Dr. Isen bakalan jelasin semuanya secara lengkap dan langsung dari ruang lab IVF.
For a patient who is relatively young, so we hope that we will be able to get a good number of eggs.
How many eggs do you expect today, doctor?
We expect about 15 to 20. Okay, 15 to 20.
Can you also mention what's the tools that you are going to use today?
Okay, so basically the egg collection procedure is quite straightforward. We have an ultrasound machine, we have an ultrasound probe with a clasp, and then there's a needle. Don't get scared by the needle. It may look very long, but actually is the portion that actually goes in is very short. Okay, so we make sure we flush the needle first, and then it goes through the clasp, and we are good to go. The three important people in the room are the anesthetists, without whom we cannot do anything. And then there is our nurse assistant next to me, and there is that young man there behind, without whom we cannot do this egg collection. Right side.
Okay. Right side 920. Right side 920.
Have you ever done OPU without anesthesia, doctor?
No. I think that all OPUs will require some form of anesthesia to be fair to the patient. Okay, to be very fair to the patient, because otherwise they get scared. Okay, they get scared, and when they come for the egg collection and then they meet an anesthetist like Dr. Satbe, who's very senior, they get assured that they are in good hands. So then it makes our life much easier. So it's important to work as a team when you do an egg collection. Everybody in the room knows. Change bottle, please. Everybody in the room knows what their job is. Thank you. So Andy has just called out that we have found the first egg, so then that's a bit reassuring to me that we are off to a good start. Change bottle, thank you. So as we suck each follicle, the fluid goes into the test tube, and then my assistant sends the tube to the embryologist, and then they will check under the microscope and look for the egg. Okay, so you see how the follicle, so the needle is there, okay, and you can see the tip of the needle, and beautiful how that follicle collapses. Yep. Okay, so we withdraw and we go for the next one.
Is the speed matter, doctor?
No. I think what is important is to be complete. Okay, so you suck each follicle until you are comfortable that it's completely empty. Takut nanti tertinggal telur. Jadinya kita kena sedut sampai habis, sampai kempis. Baru kita confident telurnya sudah di retrieve.
What made OPU challenging, dokter?
Okay, so sometimes when you are doing the retrieval, you find that despite sucking the follicles, telurnya tiada. Then you have to do a few things. You have to increase the pressure, and then you sometimes have to also change the needle. Dalam kes hari ni, the eggs are coming out, so we are quite comfortable. Tapi kadang-kadang tidak begitu ya. We have to change the needle, adjust the pressure. We use something called a double lumen needle untuk flush the follicles. So that is the most challenging. To the anesthetist also can be challenging if the patient is very fat, 100 kilos, ataupun nanti dia akan ada masalah pernafasan, nanti susah untuk mereka, bukan susah, lebih rumit, lebih rumit. So this patient is thin, so we are comfortable.
Each suction means 1 egg, or it's possible to get 2 eggs?
Each follicle should have 1 egg. Not possible to get 2 eggs from 1 follicle. What is more important is to be able to retrieve that one egg from that follicle. And so sometimes kadang-kadang patient dia confused. Dia kata, kenapa doktor kadang-kadang panggil telur, kadang-kadang panggil follicle, apa perbezaan? So apa yang saya beritahu mereka ialah, andai cuba bayangkan kalau kamu dapatkan satu balon, kamu isi balon itu dengan air, nanti dalam balon itu kamu masukkan sebiji watermelon seed, ataupun mata kucing, okay? You put inside the balloon. Jadi telur itu ialah watermelon seed. Balloon is the follicle. Jadi apa yang kita nampak pada ultrasound ialah follicle. Kita tidak nampak the egg because terlampau kecil. It is far too small, okay? But we can assume, kita anggap dalam balon itu ada telur. Itu satu anggapan. Biasanya betul, tapi tidak selalu ya. Not always.
Saat ultrasound, dokter cannot tell if there is egg
Or not.
just follicle.
You cannot. You can only look at the follicle, and the size of the follicle will correlate with the maturity of the egg. So bila kita sudah capai satu size yang tertentu, kita tahu mesti telur itu sudah matang. Biasanya lah. So you can hear the embryologist behind me has already found 15 eggs, and I'm already coming to the end of the procedure, so I'm happy that we have managed to retrieve the number that we were looking for. And anesthetist also is happy, Dr. Sadbe?
Yes, very happy.
Happy? So if the anesthetist is happy, then we are happy. So everything has gone according to the plan. Okay, so we are done. So far we have managed to retrieve 15 eggs. I think that we may find another few more as we move forward. But my job of retrieval is done. So it took us about 12 minutes to aspirate the follicles on both sides, the right side, so you can see the scan, right side and left side. So no more follicles there. Okay.
Dokter, tell us a bit about the dosage of the stimulation, type
Okay,
of...
so the dosage of the stimulation in IVF depends on two things. It depends on the age of the patient, and it depends on the number of eggs that you expect. That means the number of eggs is reflected on the ovarian reserve. Maksudnya, kalau patient itu muda dan bilangan telurnya banyak, dosage yang kita harus berikan tidak begitu tinggi. Tetapi kalau patient tu tidak begitu muda ataupun bilangan telur memang kurang, then kita harus bagi dos yang lebih tinggi. Okay, kalau tidak nanti responsnya kurang memuaskan. Nantinya bila kita buat egg retrieval, kemungkinan bilangan telur yang kita capai memang kurang. Okay, so in this particular patient, we started off with 300 units in combination, iaitu menggunakan dua jenis hormon, and the response was good, and then we were able to retrieve. So this is for pain management post retrieval. Done. Okay, we are done.
That's pretty fast, doctor.
As long as you get the follicles, then we are happy. Okay. Of course, in some patients, the follicles we may not be able to retrieve the egg so easily. Then, of course, you start to sweat. But this one has been quite straightforward. So, yes. So we're always happy to have an easy procedure. It tells us that the outcome is usually quite good. Sometimes you have a difficult patient. For example, it could be a patient with endometriosis, where the ovaries are quite high up. So when you do the retrieval, the needle has to go a bit deeper in order to reach the follicles in the ovary. So that can be a bit challenging, and then that's when a bit of experience comes in to be able to retrieve the eggs, but at the same time to be able to do it safely. Okay. So that's a challenge, to get the egg, but at the same time without harming the patient. Okay, and that's usually the more challenging cases. The ones where the ovaries are down, then when you do the scan, very easy to catch and catch.